you had COVID-19 in January, there's a big chance it's the Omicron subvariant BA.2 or the so-called stealth Omicron. This is harder to distinguish from the other coronavirus variants.
But by the time we entered 2022, starting this first week of January, almost 100% of the sequence cases we have, particularly in the National Capital Region, as well as in the Calabarzon areas, are already Omicron.
The country now has over 1,000 Omicron cases, but the most common is the stealth Omicron. A Philippine Genome Center report on January 20 looked at over 500 Omicron cases. It says there's only one original Omicron case, found in a traveler from abroad. The rest are the two other versions of Omicron. BA.1 Omicron subvariant is commonly found among international travelers, while the stealth Omicron is in most local cases. Majority of these international travelers didn't appear to have infected others, which means Omicron entered and spread in communities because of undetected cases and breaches in quarantine protocols. Quarantine officials have investigated at least 4 international travelers who skipped regulations.
Now that tells us also that there could be some hidden lines of transmission na hindi natin na-detect, or it is possible USEC na may lumabas at saka siya talaga nag-spread.
In a message to CNN Philippines, Philippine Genome Center Chief Cynthia Saloma says the earliest local Omicron case carried BA.1 from a sample collected in November. While the Genome Center report shows the first stealth Omicron subvariant was tested on December 1st from Soxargen. The first Omicron case from international travelers was tested 2 days later on December 3rd. Most of 164 patients have no or mild symptoms, especially fully vaccinated people. Saloma says there appears no difference in the symptoms between the original and the 2 Omicron subvariants infection.
Mostly upper respiratory tract infections, mostly asymptomatic ang pinakamarami at saka po milder symptoms. It doesn't mean that it cannot be lethal.
The health department has recorded 5 deaths among Omicron patients, all with underlying illness. With a heavily mutated coronavirus variant spreading, infectious diseases specialist Dr. Ranjin Solantes says we need to achieve a wall of immunity. This means vaccinating everyone who's eligible, a bigger target compared with herd immunity that only aims to vaccinate a certain percentage of the population.
I think achieving a herd immunity may not be enough to control the pandemic. Moving forward, we need everyone with this vaccine so that we can create that wall of immunity so that there will be less transmission and then less of the surges and peaks.
Saloma and Solantes say there's still much to know about the stealth Omicron, including its effect on vaccines. Caroline Bongkin, CNN Philippines.